Headaches. They creep into our lives, uninvited guests at the most inopportune times, casting a shadow over our productivity and well-being. But what exactly are headaches, and why do they seem to plague humanity with such relentless persistence? Headaches are essentially our nervous system's way of signaling that something is off balance. Imagine your brain as a complex network of wires, each transmitting vital information throughout your body. When these signals encounter interference, whether from muscle tension, blood vessel constriction, or even stress, the result is often the throbbing, aching sensation we know as a headache. Understanding the root causes of these headaches is the first step towards unlocking lasting relief. This guide will serve as your compass, leading you through the labyrinth of headache triggers, symptoms, and ultimately, effective solutions. Headaches are more than just a fleeting annoyance. They are a prevalent health concern affecting millions worldwide. From the dull ache of a tension headache to the debilitating throbs of a migraine, these episodes of head pain can significantly impact our daily lives. The World Health Organization estimates that nearly everyone experiences a headache at some point in their lives. While most headaches are temporary and benign, some can signal a more serious underlying medical condition. Chronic headaches can lead to missed work or school days, decreased productivity, and social withdrawal. Recognizing the prevalence and impact of headaches highlights the importance of understanding their causes and seeking appropriate relief. By addressing the root of the problem, we can minimize the frequency and severity of headaches, paving the way for a healthier, more fulfilling life. Embarking on the journey towards headache relief can feel like navigating a complex maze. This guide aims to simplify the process, providing you with a clear roadmap to navigate the world of headache relief. We will delve into the different types of headaches, exploring their unique characteristics, triggers, and potential solutions. From natural remedies to lifestyle modifications, we will explore a wide range of strategies to help you find lasting relief. Remember, you are not alone in this journey. With the right information and a proactive approach, you can take control of your headache experience and pave the way for a brighter, pain-free future. Tension headaches often stem from tension in the muscles of the head and neck. These headaches are incredibly common, often described as a tight band or vice-like pressure around the head. Unlike migraines, tension headaches are not usually accompanied by nausea, vomiting, or sensitivity to light and sound. Several factors can contribute to tension headaches, including stress, poor posture, fatigue, and even eye strain. Fortunately, tension headaches are usually temporary and respond well to self-care measures. Simple lifestyle modifications, such as practicing relaxation techniques, improving posture, and taking frequent breaks from activities that strain the head and neck muscles, can provide significant relief. Migraines are far more than just a bad headache. They are a complex neurological condition characterized by intense throbbing pain, often on one side of the head. Migraines can be utterly debilitating, lasting for several hours or even days. Unlike tension headaches, migraines are often accompanied by nausea, vomiting, sensitivity to light and sound, and visual disturbances known as auras. Triggers for migraines vary widely from person to person, but can include stress, hormonal changes, certain foods and drinks, sleep disturbances, and even weather changes. Managing migraines often involves a multi-pronged approach that includes identifying and avoiding triggers, managing stress, and using medications to relieve pain and other symptoms. Keeping a headache diary to track your migraines, including potential triggers and symptom severity, can be incredibly helpful in identifying patterns and developing an effective management plan. Cluster headaches, while less common than tension headaches or migraines, are notorious for their intense, debilitating pain. Imagine a sharp, piercing, or burning sensation concentrated around one eye, often accompanied by a runny nose, watery eye, and drooping eyelid on the affected side. These headaches occur in clusters, hence the name, with multiple headaches striking over a period of days, weeks, or even months. The unpredictability of cluster headaches can be particularly frustrating. Unlike tension headaches or migraines, cluster headaches are not typically triggered by stress, food, or other common headache triggers. Treating cluster headaches often involves a combination of medications to stop a headache in progress and prevent future headaches during a cluster period. Oxygen therapy, administered through a face mask, has also been found to be effective in relieving cluster headache pain. Sinus headaches are associated with inflammation or congestion in the sinuses, the air-filled cavities within the skull. These headaches often feel like a deep, constant pain in the cheeks, forehead, or bridge of the nose. Other symptoms that may accompany a sinus headache include facial pressure, nasal congestion, runny nose, reduced sense of smell, and even fever. Sinus headaches are typically caused by viral infections, such as the common cold, or allergies that irritate and inflame the sinuses. Treating sinus headaches often involves addressing the underlying cause, such as using decongestants to relieve nasal congestion, saline nasal sprays to rinse the nasal passages, and over-the-counter pain relievers to manage pain. In cases of bacterial sinusitis, antibiotics may be necessary. One of the simplest yet most effective ways to combat headaches is often overlooked: staying properly hydrated. Water is essential for countless bodily functions, including the transmission of nerve signals and the regulation of blood flow. When dehydration sets in, these delicate processes can be thrown off balance. Blood volume decreases, potentially leading to reduced blood flow to the brain, a common trigger for headaches. The good news is that dehydration headaches are often easily preventable. Make it a habit to sip water throughout the day, aiming for at least 8 glasses of water or other hydrating fluids. Carry a reusable water bottle with you as a visual reminder to stay hydrated, especially during physical activity or hot weather. If you do develop a dehydration headache, replenishing your fluids is key. For centuries, essential oils have been prized for their therapeutic properties, offering a natural approach to alleviating various ailments, including headaches. Peppermint oil, with its refreshing aroma, is a popular choice for headache relief. Its active compound, menthol, creates a cooling sensation when applied topically, potentially helping to ease tension headaches. Lavender oil, known for its calming and relaxing properties, may help reduce stress and anxiety, common headache triggers. To use essential oils for headache relief, you can add a few drops to a diffuser, creating a calming aromatherapy experience. Alternatively, mix a few drops of essential oil with a carrier oil, such as coconut or almond oil, and gently massage the blend into your temples, forehead, and back of your neck, avoiding the eye area. Always dilute them in a carrier oil before topical application and perform a patch test on a small area of skin to check for sensitivities. In our fast-paced world, stress has become an unwelcome companion, often manifesting as physical tension, particularly in the muscles of the head, neck, and shoulders. Relaxation techniques such as deep breathing exercises, meditation, and yoga can be powerful tools in breaking this cycle. These practices help to calm the nervous system, reduce muscle tension, and promote a sense of overall well-being. Deep breathing exercises, as simple as they may seem, can have a profound impact on our physiological state. When we breathe deeply, we activate the parasympathetic nervous system, our body's natural relaxation response. Yoga, with its combination of physical postures, controlled breathing, and mindfulness, offers a holistic approach to relaxation and stress reduction. Temperature therapy, a simple yet effective approach to pain management, can be surprisingly helpful in alleviating headaches. Applying heat or cold to the affected area can help to relax muscles, reduce inflammation, and ease pain. For tension headaches, applying a warm compress to the back of the neck and shoulders can help to relax tense muscles, easing pain and discomfort. For sinus headaches, a warm compress placed over the sinuses can help to open up nasal passages, promoting drainage and reducing pressure. Cold therapy, on the other hand, can be particularly helpful for migraines. Applying a cold compress or ice pack wrapped in a towel to the forehead, temples, or back of the neck can help to constrict blood vessels, reducing inflammation and numbing pain. Experiment with both hot and cold therapy to see what works best for you. The old adage, "You are what you eat," holds particular relevance when it comes to headaches. Processed foods, laden with artificial ingredients, preservatives, and unhealthy fats, can disrupt our delicate hormonal balance and trigger inflammatory responses within the body. Common food triggers for headaches include aged cheeses, processed meats containing nitrates, alcohol, and foods high in tyramine, an amino acid found in fermented and aged products. Caffeine, while a temporary pick-me-up, can also trigger headaches, especially when consumed in excess or when withdrawing from it. Focus on consuming a balanced diet rich in whole, unprocessed foods, including fruits, vegetables, lean proteins, and healthy fats. These foods provide essential nutrients that support our body's natural healing processes and help to maintain stable blood sugar levels, reducing the likelihood of headache triggers. In today's sedentary world, it's easy to underestimate the profound impact regular exercise has on our physical and mental well-being. Exercise is not merely about building muscles and burning calories. It's a powerful tool for managing stress, improving sleep, and reducing the frequency and severity of headaches. When we engage in physical activity, our brains release endorphins, natural mood boosters that have analgesic properties, meaning they can help to reduce pain perception. Exercise also helps to regulate our sleep-wake cycles, promoting restful sleep, a crucial factor in headache prevention. Moreover, exercise can help us better manage stress, a common trigger for both tension headaches and migraines. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Choose activities you enjoy, as this will make it more likely that you'll stick with it. Brisk walking, jogging, cycling, swimming, dancing, and yoga are all excellent options. Sleep is not a luxury. It's a fundamental biological need, essential for our physical and mental well-being, much like air, water, and food. During sleep, our bodies and minds undergo essential restorative processes, repairing tissue damage, consolidating memories, and regulating hormone production. Sleep deprivation can weaken our immune systems, increase our risk of chronic diseases, impair our cognitive function, and make us more susceptible to headaches. Establishing a regular sleep schedule, even on weekends, can help to regulate our body's natural sleep-wake cycle, promoting more restful sleep. Create a relaxing bedtime routine, such as taking a warm bath, reading a book, or listening to calming music, to signal to your body that it's time to wind down. Ensure your bedroom is conducive to sleep by making it dark, quiet, and cool. Avoid screen time for at least an hour before bed, as the blue light emitted from electronic devices can interfere with melatonin production, a hormone that regulates sleep. In our tech-driven world, many of us spend hours hunched over devices. This can lead to muscle tension and headaches. Poor posture strains our neck, shoulders, and back. Over time, this causes pain and discomfort. Improving posture can reduce headaches. Be mindful of your posture daily. Sit with feet flat, relaxed shoulders, and a straight back. Use a supportive chair and lumbar pillow. Take breaks to stand, stretch, and move. Strengthening exercises like yoga help. Consult a physical therapist for guidance. Stress is inevitable, but managing it well is crucial for well-being and headache prevention. Identify stress triggers and develop healthy coping mechanisms. Exercise, meditation, and seeking support can help. You don't have to navigate life's challenges alone. Proactive stress management improves well-being. When headaches strike, it's tempting to reach for over-the-counter pain relievers. These medications can provide relief, especially for tension headaches and migraines. However, it's essential to understand both their benefits and potential drawbacks. Not all OTC pain relievers are created equal. Consult with a pharmacist or healthcare provider if unsure. OTC medications are for short-term use, not long-term solutions. Two common OTC pain relievers are NSAIDs and acetaminophen. NSAIDs reduce pain and inflammation by blocking prostaglandins. Acetaminophen blocks pain signals in the brain and spinal cord. Both can cause side effects if taken in high doses. A word of caution: using medications wisely. Over-the-counter pain relievers can help, but overuse can cause more headaches. Follow dosage instructions and consult a healthcare professional. Be aware of potential drug interactions. Inform your healthcare provider about all medications. Reclaiming your life. A proactive approach to headache relief. As we've journeyed through the intricacies of headaches, from understanding their various forms to exploring a range of remedies, one crucial theme emerges. Taking control of your headache experience is within your grasp. It begins with recognizing that you are not a passive bystander in this process. Instead, you can become an active participant in your own healing journey. Remember that headache relief is not a one-size-fits-all solution. It's about discovering what works best for your unique needs and circumstances. Embrace a proactive approach by paying attention to your body's signals, identifying your personal headache triggers, and exploring a combination of strategies that resonate with you. Start by incorporating the natural remedies we've discussed, such as staying well hydrated, experimenting with essential oils, practicing relaxation techniques, and trying temperature therapy. These simple yet effective methods can provide significant relief without the potential side effects of medications. Empowering yourself, listening to your body's signals. Consider the lifestyle modifications we've explored as investments in your long-term well-being. Adopting a balanced diet rich in nutrient-dense foods, engaging in regular physical activity, prioritizing restful sleep, maintaining good posture, and cultivating effective stress management techniques can have a profound impact on your overall health, reducing your susceptibility to headaches and enhancing your quality of life. As you embark on this journey of self-discovery and healing, remember to be patient with yourself. It takes time to identify patterns, experiment with different approaches, and fine-tune a headache management plan that truly works for you. Celebrate small victories along the way and don't be discouraged by setbacks. Remember, even small changes can make a big difference over time. Perhaps the most empowering aspect of this journey is learning to listen to your body's signals. Headaches often serve as our body's way of telling us that something is out of balance. Instead of viewing headaches as merely a nuisance to be masked with medication, consider them an opportunity to pause, reflect, and make positive changes in your life. Embrace wellness for a brighter, pain-free future. Seek guidance from healthcare professionals for frequent or severe headaches. They can provide personalized advice and recommend treatments. Seeking help is self-care and empowerment. Access expertise to reclaim control over your well-being. Embrace a holistic vision of wellness. Create a life where headaches don't limit you. Adopt a proactive approach to headache management. Embrace natural remedies and lifestyle changes for a vibrant life.